Hi, my name is Dr. Karen Hurley, and I'm a psychologist at the Cleveland Clinic. And I've been specializing in working with people with hereditary cancer risk for over 20 years. I've presented at Force a number of times. It's my privilege to be back again under different circumstances. I miss that moment of stepping up to the podium and looking out at the room and looking at all the faces, all the people who have come together to confront important questions about how to live and live well and fully with hereditary cancer risk. But we do have the technology, so here we are, and we're using it. So what I'm going to be talking about today is talking with children about risk. And this could be both minor children or even adult children, because people learn about their risk at different times during their lives. What I'll be talking about, it partly comes from research, and it partly comes from being in the room, is psychotherapy room, with many, many people who have shared their stories with me over the years. Before we begin, I just want to say I have done some speaking for Ambry within the last year, but I will be not talking about any products or services or any kind of medication, and any photos that you see do not depict an actual patient. So when people come to me for a session about talking with their children about risk, they usually are looking for some words to use. What words can they say that's going to make this come out okay, that's not going to overly upset their children, and will maybe motivate them, if they're at the appropriate age, to go get testing. But what I hear is more the question at the emotional level, which is a parent asking, how do I go through with this? How do I have this very difficult conversation and share information that affects all of us very deeply? So one of the things that makes this conversation difficult is the fact that genetic risk is random. At least from the perspective of science, risk is a 50-50 chance of passing on a mutation, and we don't have anything that can explain who gets it and who does not. However, this goes against beliefs that we might have, whether they're spiritual beliefs, ethical beliefs, about order and fairness in the universe. Why would something that's so important to the well-being of you and your family be up to chance? Genetic risk also goes against another very powerful instinct, which is our mammalian nature of wanting to protect our children. In fact, parents who undergo genetic testing or who are looking for it, one of the most common reasons they say they want testing is because they want to learn more about their children's risk. And also, we see that people who are making choices about, say, treatment or risk-reducing surgeries, people who are young parents are often motivated to choose the most intensive option because they want to do everything possible to be there for their children. Now, if we take that instinct to protect, which is very powerful, and then we put that up against the randomness of the universe, something that we can't really influence or protect, how do we put those together? So we don't do helplessness very well psychologically as human beings. So what often happens is that parents will then feel guilty. And no matter how many times we say, inheritance is random, you often see someone feeling guilty, because if it's something that you passed along, at least that's an illusion of control, which, painful as it is more comforting than to think about how little control we actually have. So in going into a conversation about sharing risk information with a child, whether it's a young child or an adult child, is how you see yourself as a parent matters. So some parents will define their role as things such as, I need to keep bad things from happening to my child. There's that protective instinct. Or I need to keep them from having any negative experiences or bad feelings. Sometimes they'll say they want to preserve their child's innocence, even if just for a little bit longer. But you can see that given the uncertainty that comes with hereditary cancer risk, that if you define yourself in this way, that that's what you're trying to do, is there's a conflict and a risk of not being able to carry this out. So it boils down to what I call protection versus trust. Sometimes parents will shield children from information, but what happens then is that with the information not being shared, then it becomes isolating rather than having an opportunity to bring the family together. In particular, parents who say things like, oh, let her have her college years, or, just let him get through his, his senior year, something like that. And then the child finds out later that there was information that could have been shared, right? This can lead to feelings of betrayal or feelings of mistrust. Well, if you didn't tell me that, what else are you not telling me? So then it requires some restorative or reparative work. It also, especially with the adult children, it denies them the opportunity to grow by not telling them information because you're afraid it's going to hurt them in some way. Then they don't have that opportunity to rise to that occasion, to dig down and find coping skills that maybe they didn't know they had before. So why tell children about risk? Even the young ones will witness that there are appointments happening, you're going to the doctor more frequently, maybe you have an upcoming surgery, or maybe there's been a loss in the family. So they need to have some way to understand what's going on. Especially now that hereditary cancer is more commonly discussed in the news, children may hear about it in media or online, or even in a science class where they have read material or have lectures about hereditary risk. So what happens is when we don't talk to children, for example, if they see that you're more emotional than usual or seem stressed out because you're going to the doctor a lot, some children will take on what I call emotional jobs that might be beyond their abilities. So they will, in their child mind, will say, well, if I'm good enough, right, if I get an A, maybe, dad will be less stressed and be happy, right? So they try to essentially take care of the adults around them. So what does that mean? If you're going into a conversation about risk, is that you want to take care of your feelings first so that you're fully available to focus on the child's feelings and needs in that conversation. So, the example of putting your oxygen mask on first before helping others, it's a common one to say you need to take care of yourself first. But here it really is, whenever you see these videos on an actual airplane, they show a parent putting the mask on the child first, even though that goes against the instinct or of wanting to make sure that the child is okay first. So if we take this as a metaphor, what does that actually translate into? It means processing your own feelings about your genetic risk first, whether that's guilt, sadness, fear, anger, helplessness, all of the above, or other feelings that I haven't mentioned. Really important that you have at least one adult who is your support system that you can say anything to without feeling judged. This might be your partner, it might be a close family member, but they also may be stressed by genetic information, especially if several people are getting tested at once. So you want to make sure that someone is emotionally available to support you during a difficult time. Then, the feelings, however intense they are, feelings do pass. So you want to allow that first wave to pass so that you're not going into the conversation with your child at the height of your feelings, but rather you've taken care of your feelings enough so that you can notice, how your child is receiving the information and what do they need to understand what's happening. So with that said, I want to give you some actual tips. These all come from a really wonderful website posted by the Massachusetts General Hospital, Parenting at a Challenging Time. The site is designed for parents who are going through actual cancer, but even if for parents who are going through a genetic diagnosis, in the absence of having cancer, probably 90% of the advice still applies. So the first one, and I thought this was really important, the worst way to hear news is to overhear it. Now, even little kids, it's like they have antenna. They can tell what's happening. They know that, for example, they might walk into a room and all the adults stop talking, or they overhear a parent crying on the phone or having really intense discussions. And so if they don't have some idea, or at least a kid-sized amount of information about what's happening, is that they may start making up their own stories, which might be worse than what the actual reality is. So it's important to give them something that is sort of true, what they need to know, and so for example, they don't need to know all the ins and outs of autosomal dominant inheritance, but they do need to know, dad's going to be in the hospital for a few days. Another thing is, because children may have at least started to piece things together, especially the older ones, is to ask what they already know or what they've noticed, and then build on that. And so that way, if they have some assumptions or misinformation, you have an opportunity to bring that out and correct it. It's also really important to use, as I said, kid-sized language that's appropriate to their level, not using euphemisms, because that can lead to confusion. So for example, this would be a boo-boo, and there it is. And this is not a boo-boo. So saying, oh, so mom's going to the doctor because she's a boo-boo on her breast, then that might confuse a child who says, well, am I going to have to go to the doctor? Am I going to have a surgery because you have a boo-boo and I have a boo-boo, right? A more developmentally advanced version of that is, this comes from a qualitative study of teenagers talking about their perceptions of risk-reducing mastectomy. And so here you can see, here's a teen who was thinking about the double mastectomy as basically a free boob job, right? And so that she wanted to get tested quicker because in her country, it would be covered under her health plan, and that she can have a boob job that she wanted to have anyway, and she doesn't have to pay for it. Not thinking about the emotional implications, not thinking about risk to other organs, or what the implications for fertility might be. Another thing is that you might rev yourself up for a big conversation with your child, and then they say, okay, mom, that's nice. Can I go back to my game, right? So you want to follow the child's lead about how much or how little they want to know at a particular point. They may have a different pace of processing than you do. And so therefore, it may take some time for them to come back to you with a question or concern. And following on that is that, see, if you, instead of focusing on having one big conversation, I mean, who wants to, sit down on a couch and say, oh, I have something to tell you? That's usually alarming, even between adults. It's rather to see the communication as a process, so that you can have an initial conversation, signal your openness to questions, and then provide other opportunities for questions to come up and emotions to come up over time. So these kinds of side-along activities are a good opportunity where there's a focus on an activity, and then a question might kind of bubble to the surface. Another really good opportunity is maybe in a car. You're driving your teen somewhere, you're both looking ahead of you rather than directly at each other. And then that might be a time where they feel a little bit safer to bring up something that's on their mind. So another way to think about this is, naturally as a parent, you want to focus on how are they feeling, how are they doing, and keeping them safe. But because of, for many of the mutations that and genes that are applicable to people in the audience, don't kind of rear their heads, so to speak, until adulthood. With the kids, one of the best things you can do for them is to help them keep on a developmental track as much as possible. So it means even if there are surgeries planned or things like that, that you help them maintain their routines of regular meals and sleep. And, I have school. You can tell this is an old slide because of course, school has been turned upside down in the last year and a half. But, that's been something we've all been trying to do in the last couple of years of the pandemic, is to try to reestablish routines that are normal-ish as much as we can manage. It's important to support kids in carrying out their regular activities that, even with stuff happening with the adults, it's okay to be focused on school, to celebrate achievements, to continue to have contact with friends and to play and to engage in hobbies. But one thing that you can do, especially during the surgery recovery period, it can help to give a kid an age appropriate or a kid-sized task to do. So say you've got a 7-year-old, maybe their special job is bring the orange juice in the morning, right? So they have a role, it's clear, they can have a success with it, and to know that the adults are doing the adult-sized jobs. So what I'd like to do now is to briefly share a couple of cases. The details are changed somewhat to conceal their identities. But these are two that stuck with me over the years and that really taught me a lot about what does it mean to parent a child when there's genetic risk in a family. So this is a patient whose mom died of breast cancer when she was only 2.5, and she had an older sibling who was 5 years old. She remembered very little of her mother's illness, or even of her mother herself, or why she was gone after a period of time. The patient's father remarried within 3 years and never talked about the patient's mom. There was a new mom, right? And so they were trying to build a new family, but that left the patient with these shadowy memories that, she couldn't really talk about or express. And then she wound up with symptoms of panic. She had lots of superstitious beliefs that if she talked about her feelings, something bad would happen to her. Now, she actually tested negative for BRCA, given the breast. Now, perhaps years later, she would, on expanded testing, have a BRCA mutation that hadn't been found yet, or maybe one of the other mutations that some of you might have, such as a PALB2 mutation. But she realized that nonetheless, her main connection with her was thinking about whether she was at risk for the same thing that happened to her mother. But the most distressing thought, and this is where she really needed some support, was that she started to think about her mother and what it must have been like for her mother during her final illness, knowing that she would be leaving her daughter behind when she wanted to stay with her. And she said that thought, she had this image of a locked box of emotion inside her, of fear and rage and unbearable sorrow. So this is one of the reasons that it is important to talk with children about, at least in some ways, about what's happening, so that they aren't carrying emotional burdens that they can't even really name. The other one, this is a situation that comes up more often. This was a this is also a case of a mother who died of breast cancer. This time the daughter was age 7. The family was devastated. The father and daughter became each other's best friends and best support. Then there was someone else on the mother's side of the family who also developed breast cancer and tested positive for a BRCA mutation. So the patient actually was present at the appointment where this other relative got the result. And during her teen years, she developed depression and somewhat alarmingly anorexia that required an inpatient stay. And then she presented on her 18th birthday asking to be tested, saying, "I just want to know." But she was not fully processing, what were all of the risks and benefits of testing. So we spent 3 sessions together. And the thing that finally got through to her was that her risk of cancer was in the future, but her risk of a relapse of her anorexia was right now. And that's what we needed to keep our focus on. So we developed a self-care plan that if she wanted to get tested, that she needed to first process the seriousness of what does it mean to learn her mutation status and what was her self-care plan going to be. She was planning to go off to college in a different state. So she came up with a plan that she was going to seek out psychotherapy on campus, and that she was going to stay in regular contact with people who could see her and see her body weight so that she wasn't undergoing relapse. So with that plan set up, she did go ahead and get tested. Unfortunately, she was positive, but I will never forget this moment. She turns to her father and says, "You're going to have more baggage about this than I will." And so what I took from that was, it wasn't that she just had to know, her father had to know. Was he going to lose his daughter after losing his wife? So in conclusion, when you're thinking about having one of these difficult conversations, and I gave you examples that involved family bereavement, and there are many more scenarios and situations that you might face, but some general principles are to think about both the child's numeric age, but also their maturity level. What can they handle? So what's the minimum amount of information that they need to get through the next period, understanding that you may elaborate on that information as they get older. Then you also want to consider the age. If you have several children, especially if there's an age spread, do you want to tell them all at once, or do you maybe want to separate them, telling the older children more about more elaborate version, and for the younger ones a more simple version of parents going to be in the hospital, they're going to be okay, this is a procedure, having to stay safe, things along that line. You want to think about, how does your child typically signal distress? Some children can articulate things like, "I feel mad" or "I feel sad," but they also might show their feelings in behavioral issues, or falling grades in school, or getting headaches and tummy aches. So you're going to be the best judge of knowing your child and how they feel. So, and also in preparation, think a little bit about what you hope for or imagine as the outcome. What are you hoping? How is this conversation going to serve the family? How is this going to help things move smoothly during a potentially stressful or difficult time? So maybe one way to think about this is that you want to be honest and real about what's happening, but leaving a doorway open for hope, for that best possible outcome. So in conclusion, I would say, putting your own mask on first is a very important task as a parent. Easy to say, harder to do. Go ahead and take your time. It's worth spending a little extra preparation time, maybe even seeking out some guidance from a physician, a social worker, a psychologist, some trusted professional. Trust your own knowledge of your child, and to take that guilt that you feel about wanting to protect your child to thinking about, what do you want to teach your child about coping with challenges in life. Because, one of the awkward things you have to do as a parent is to sit down and have that facts of life talk. But there are also what I call the other facts of life, and that is that cancer and cancer risk forces you to think about things that most people prefer not to think about. We're all subject to random events. We're all subject to hard times, and we're all subject to mortality, whether or not we carry a particular risk mutation. So, given those facts, the legacy that you can give to your children are these life's lessons about what do you do when life gets hard? What do you do when things are uncertain, when there are things that are out of your control, when you have to make really tough decisions that no one would have to make, when you have to deal with really strong or painful feelings? These are things that you have to offer your child that go well beyond the effects of one particular mutation that allows them to meet any challenge in life that they might face. So with those thoughts, I say thank you very much. And I hope that that you have a really great experience with the many experts that you'll encounter in this conference. Thanks so much.